Mugshots! I am Doc Emy Cua and this is Mugshots Now, a modern digital Filipino media platform. Watch life from a new perspective, bringing a new flavor of fun, a new revolution of entertainment, giving you our best shot. As the expert, health is a state of body and wellness is a state of being by Jay Stanford. Hello mga ka-Mugshots! Welcome to MugPahaba ng Buhay every Tuesday at 6 p.m. Please follow us on Facebook, Twitter, Instagram, and YouTube. Ang episode natin today is about female infertility and ang makakasama natin today ay si Dr. Cindy Sotalbo, isang Interventional Radiologist. Siya ang ating co-host today. Hi, Dr. Cindy!
Hi! Magandang araw po sa inyong lahat. Thanks for having me.
And of course, our very special guest for today ay isang expert sa larangan ng female infertility. Siya ay affiliated with the Philippine General Hospital and Victoria Art Center, Dr. Gia Pastorfide.
Hi, everyone. Thank you for having me.
Okay, so hindi na po tayo magpapaligoy-ligoy pa. We'll start with our questions for today. So, of course, this is a very interesting topic kasi parang lahat tayo, all our lives were put on hold, di ba, Dr. Cindy, ngayong pandemic?
Yep, agree. And
yes,
this is, I think, our topic for this session is very apt for our age kasi I'm sure there are females out there and couples out there who are curious about our topic but they don't know where to start, so this is very helpful for them.
Yeah, so actually our first question, Dr. Gia, is who is a good candidate for egg freezing?
So basically yung egg freezing, let's go tackle first the concept of what is egg freezing. So yung egg freezing is when a woman will bank her eggs for future use. So basically, there are two types of people who would undergo egg freezing. Yung isa, yung medically related na mag-egg freeze sila, and the other one is the social freezing. So who are the medically indicated patients that would undergo egg freezing? There's many, pero amongst the most common ones are maybe one, those people who would have to undergo chemotherapy or radiotherapy. Now, these procedures kasi nakaka-damage yan ng normal ovaries. So prior to undergoing that kind of procedure, they freeze their eggs already so they can use that in the future before they undergo such procedures. Two, those patients who have a history of early menopause in the family, we call that primary ovarian failure. So, yung mga pasyente na to, kahit mga 40 years old, no, nag-menopause na sila. So, for them, it would be prudent to freeze their eggs before they reach menopause. Kasi once you're menopausal, hindi ka na makakakuha ng eggs. And maybe another subset of patients who would undergo egg freezing are those who had ovarian cysts. There are cysts that can go very large in the ovary, no? So, kailangan matanggal yung ovary. Pag ganun, pag walang ovary, there's no source of the eggs anymore. So these are the kinds of patients that we encourage to do egg freezing. Now, we also have another subset of patients who would undergo egg freezing. That's the one that we call social freezing. Those are basically patients who, number one, who haven't found their Mr. Right yet. So they want to extend their reproductive lifespan. So they freeze their eggs when they're young. So when they find their partner already in the future, then they can use that when they get pregnant, no? And then a second one are for those who are too busy right now with their life in terms of career or studies. You know, like in the States nga, they have an employee perk sa Google, sa Facebook, sa Apple. Yung female employees nila, part of their work perk is that they allow their employees to freeze their eggs. So they can actually focus first on their career, and then when they're ready to have a family, they will use those eggs na.
Okay. Actually, mga ka-Mugshots, kaya rin ako nandito at sinasamahan si Doc Emy ngayong araw ay dahil kasama ako doon sa mga dinescribe ni Doc Gia na namiling magpa-freeze ng eggs dahil busy pa po ako. Ayun. So,
Very typical
sige.
of a doctor, no? Kasi actually yung mga doctors, they start, making family already later on in life.
Oo nga.
Delayed na sila with their milestones, no? So they end up marrying later, and of course, they end up having families later pa.
Oo nga po eh. Actually, this concept of egg freezing is, naman na, kilala na siya ngayon. So, pero, the session is dedicated to inform our friends out there who want to know more. So, Doc Gia, how do we go about it? What's the process of egg freezing? And then, meron po bang age limit? Meron po bang recommended time to do it?
Yes, so for the process, it would take around 10 to 12 days, no? So we usually start the treatment day 2 of the period. So for the next 10 to 12 days, the patient will be receiving daily injections. Now, what do these injections do? They make the ovary produce multiple follicles. And it's these follicles in the ovary that contain the eggs. Those are the eggs that we want to harvest and freeze. So for 10 days, the patient will be getting her daily injections. At the same time, they might have serial ultrasound monitoring also for the growth of the follicles and some blood work also done. And then after those 10 to 12 days, after the egg harvest, which is a 30-minute outpatient procedure, so they don't even have to be confined, no? It's a quick procedure done under anesthesia, so they don't feel any pain. They'll be asleep. And then after the harvest, they can go home the same day, and then they already have insurance for their future.
So, Doc, parang how safe is it, or how safe are the eggs with the banks that we have here?
So
the egg banks.
We do cryopreservation. Their safety in terms of, because the issue that I would think of is if there's mix-ups with eggs, no? But the laboratories have strict processes to do quality checks, so as not to confuse the gametes or the eggs of one patient from another.
Actually, Emmy, so I had my freezing already, done. And in terms of this time, I mean, in the COVID context, we are very lucky kasi yung clinic nila Dr. Gia, hindi sila tumigil tumanggap ng patients, and they were very strict with implementing health protocols. So, yung mga takot na mag-proceed because may COVID, marami nangyayari. Parang at least I can say from my personal experience, so the clinic at Victory, very safe yung feeling ko, and honestly, wala akong masyadong tulog tama si Doc Gia. Painless, tas tulog lang ako at pagising ko tapos na. So, umuwi din ako the next day. I was able to work the next day. So, it's very, actually, wala akong ma-share during the experience kasi nga hindi ko maalala. Tulog lang ako. I was in very good hands.
So, yeah, we really have to adapt to the times, no? Because in some cases also, especially women are getting older, their biological clock is ticking. It's not something that we can afford to postpone. So for cases especially na above 35 years old, we really have to adapt to the times that we try to give safety protocols. So in our center, we require patients to have a COVID negative swab before they undergo any procedure, because for the safety of other patients and our staff as well. So apart from that, I think it's also actually the interest for egg freezing is much more nowadays, because people are trapped with the lockdowns and their lives are on hold, no? So siguro yung mga tao hindi nakaka-date ngayon masyado, they can't meet people. So
Can't find Mr. Right.
If I'm getting older and I still haven't found someone, I might as well bank my eggs, and I won't wait for it to get any older.
Doc, isa pang question na talked about in our circles kasi, and I want this information out there. Meron bang, since we are in a Catholic country, marami
Yes.
silang nagtatanong, bawal ba na magpa-egg freeze pag wala ka pang asawa?
No,
Kung,
actually, that maybe that's the question of when does life start, no?
oo
So
nga.
the egg is a gamete, no? So if you are actually having your monthly menses and you ovulate that egg and then it just goes away, so it's not really where life starts. So egg freezing is not it's not unethical, so we can do it. They shouldn't fear about the religious impact or anything like that. So
Yes.
basically the egg freezing is an insurance for us in the future if you want to have a higher chance of a healthy pregnancy, because a younger egg will more or less give you a healthier pregnancy.
Very nice to hear
Yes.
po.
Yeah.
Yes. So, Dr. Kuya, for some people who found naman their Mr. Right na, but they had been trying for so long, until when ba na magpe-pray na lang po tayo, or until when ba that we really have to consult a reproductive infertility specialist already?
Yeah, that's a good question, Emmy, no? Because some people, kung hindi pa sila nakakabuo, tapos 1 year has passed, they would think na, oh, we weren't trying hard enough, or they would think it's normal. Actually, within 1 year, 80% of couples will already have conceived. So if you haven't already conceived within that point, it's already time to get a checkup. You can still have a checkup with your general OB. They will probably request for some labs, do an ultrasound just to check if everything's okay, a semen analysis for the partner. Basically, yun, 1 year, and if you haven't conceived, it's time already to do a checkup. But there's a caveat to that then, no? If a woman is older than 35 years old, you don't need to wait for that 1 year. Baka medyo strict sila na hintayin talaga nila na 1 year mag-elapse, no? 6 months actually of not conceiving, it's time already to get a checkup. And if you also know that you have problems like endometriosis, PCOS, myoma, you know your partner has low sperm count, you don't need to wait for that 1 year. It would already be prudent to go and have yourself checked.
So Doc, ang recommendation talaga is the couple seek consult together kasi both sides
That
will
would be the
test.
best. Yeah. Oo. Kasi both the husband and the wife will already understand what the other is going through. No? And then they will know what part they have to play when you're treating them already. So another frequent question that's usually thrown at me also is, say for example, they're seeing their general OB already. How long before they need to really see an infertility specialist? Because actually, the generalist can still try to help you conceive. They can give you fertility drugs na you can take orally. But if that kind of method does not work already for 3 to 6 cycles, then it might be time to see an infertility specialist who might be able to offer procedures with a higher success. Yung procedures like an IUI or an IVF.
Ayan. So, yan ang susunod nating tanong. Doc Gia, ano nga ba yung IUI and IVF? Explain natin sa mga viewers natin.
Yes. So these are procedures that will help women conceive, and they're considered already as assisted fertility procedures, no? So yung IUI, basically in that process, we actually give medications to the woman so she will ovulate, no? So para mangitlog siya, tapos kung ovulating na siya, we will do the intrauterine insemination. So some people might know it as an artificial insemination. That process, we take the sperm from the husband, tapos we'll process it para matanggal yung sperm na hindi nagsiswim or yung mga non-moving sperm, and only the good-looking sperms we will directly inject inside the uterus. So what does that do? When you directly inject the sperm into the woman's uterus, you make the distance between the egg and the sperm closer. Given that you just make the distance smaller, there are things that you still need to fulfill. So number one, the woman still needs to ovulate. So kailangan nangingitlog pa rin siya. And two, because the sperm has to swim and meet the egg, kailangan hindi barado yung fallopian tubes niya. So at least one of the fallopian tubes must be patent. And lastly, the man has to have an adequate number of motile sperm. Because as I mentioned earlier, the sperm still has to go out and swim and meet the egg. So kung masyadong konti yung sperm count niya, talagang bababa yung chance of success of an IUI. Now, the IVF is different in that it will completely circumvent the fallopian tubes. You don't need the fallopian tubes because basically you'll be taking the egg from the girl and then the sperm from the male, and then in the laboratory you will fertilize it. So when you fertilize it already in the laboratory, baby na siya. Ipapasok yung baby directly in the uterus, tapos hihintayin na lang kung kumapit o hindi. So there's a 2-week wait before you wait for the pregnancy test. Now,
okay, thank you, Dr.
Sige.
No, go ahead. Sorry.
Yeah, just to further clarify, no, when I was saying that you get the eggs from the woman, this is basically the procedure of the egg freezing. So again, we give the daily injections para yung ovary nila mag-produce ng many follicles that contain the eggs. And that's when we harvest the eggs and then fertilize it with the sperm of the husband. I think now would be a good time to show the timeline, no, Emmy?
Yeah. Thank you, Dr. Gia, for this. And for now, we'll take a short break. Then when we come back, we'll answer more questions about this assisted fertility. We're back and welcome back again to MugPahaba ng Buhay. Ako si Dr. Emy Cua, and today we have two special guests, our co-host, Dr. Sotalbo, our interventional radiologist, and Dr. Gia Pastorfide, a female infertility specialist. So bago po tayo nag-break, we have one question that we left hanging. Dr. Gia, when should my husband and I consider in vitro fertilization?
So we usually tell patients na when we treat them for infertility, we do a stepwise approach, meaning we try to do the more conservative options first, and then we fall back as the IVF. That's because it's the most expensive, it's the most invasive, but it's the procedure that will give you the biggest chance of success, no? So yung una, kung hindi mabuntis siya sa follicle monitoring and timed intercourse, then maybe we can suggest to do around 3 to 6 cycles of IUI, the intrauterine insemination. And if that doesn't get the female patient pregnant, then maybe we can suggest to do the IVF. But there are cases when we would tell the patient na that your chance of getting pregnant will be through IVF is when they have conditions like blocked fallopian tubes. If you remember earlier, I said that intrauterine insemination requires that at least one or both tubes should be open, no? Dapat hindi barado kasi the sperm still needs to swim up and meet the egg. So kung barado yung fallopian tube, the only way really to get pregnant is to harvest the eggs from the woman and fertilize them in the laboratory with the husband's sperm. So maybe we should just take an in-depth look at an IVF, no? So this is a process of an IVF cycle. So you can see that red dot there, that means the first day of menses. We usually want to start their stimulation day 2 of their period. So you can see the bottom blue arrow. They're giving daily injections. These are actual hormone preparations na that would allow the ovary to produce many follicles. So you can see in the picture in the left, no, the first picture, ito maliit pa yung ovary dyan, tapos maliliit pa yung follicles. As opposed to a stimulated ovary, the one that you can see in the right, malalaki na yung mga follicles yan because of the injections that you give. So usually pag ganyan na yung size, we say that that's ready for an egg harvest already. So you can see after those injections, there's a 36-hour wait, and then you have the oocyte retrieval. That's the egg harvest. And then after 3 to 5 days, we do the embryo transfer. After which, they will give you some medications, yung sinasabi natin pampakapit. We'll wait 2 weeks and then do the pregnancy test. So all in all, siguro it will take you 1 month if you're going to try to get pregnant with IVF, with a fresh cycle.
So, Doc, kunyari, given successful na meron ng nabuong embryo and that na-implant na, how do we make sure that the embryo or the baby is normal? Is there any parang genetic testing available to us to check kung okay yung baby? Or,
Yeah.
and also, malalaman ba agad kung female or male? Kasi yun yung mga curiosities ng couples agad eh.
Yes. Actually, before you do transfer, there's a test that we can do, which is the PGT, no? Pre-genetic testing. So, yung test na yan, tinetest na in the chromosomal level yung embryo. So, bago pa i-transfer, bago gawin yung embryo transfer, tinetest na kung okay, genetically okay yung embryo. Ang tinatransfer lang kasi are euploid embryos. That's what you call the normal embryos. The aneuploid embryos, you don't transfer those because those are the ones with a higher chance of genetic problems, and in effect, sila din yung higher chances of having a miscarriage tapos hindi tutuloy as a live birth, no? Since you are looking at the genetics already of the embryo, in effect, you will also be able to see kung XX or XY na yan. So malalaman mo na din kung male or female. Although ethically, we do not perform this test just to see the gender, no? These are tests which are indicated in patients who have a history of genetic problem talaga. So they want to test, kunwari, may thalassemia sa pamilya. They don't want to transfer embryos that are affected by thalassemia. Or we also use this kinds of testing for patients who are older because as a woman ages, the chances of her producing aneuploid embryos are higher. Mas higher yung chance na may genetic problems yung embryo. So by doing that test, we will be able to see which are the aneuploid embryos which we will not transfer.
So you're saying, Doc, na it is not part of the routine?
Not in a fresh cycle.
In a fresh cycle, okay.
Yeah. Because when you do this PGT testing, you actually have to take a biopsy of the embryo. So we do this biopsy when the embryo is in day 5 or day 6, no? And then after that, we'll do the genetic studies. So you cannot transfer it in the same cycle. In fact, you will have to do a frozen embryo transfer because you will transfer it in the next cycle, in the next menses of the patient, because you will have to wait for the results of your genetic testing.
Yeah, actually, Doc, I have a question kasi my specialty, I see a lot of breast cancer patients, and sometimes there's so many treatments of breast cancer that sometimes, often than not, we really forget na may concerns yung patients about their fertility. So when do you suggest that these cancer patients see a fertility specialist? When should we actually make them see a fertility specialist during their treatment?
They should see the infertility specialist as soon as possible. In their case, they are qualified for fertility preservation. So eventually, you might have to do chemotherapy. I mentioned earlier, no, you might have to do chemotherapy, and those interventions will be damaging to the ovaries. So she might need to do an egg harvest, or we can even do ovarian tissue cryopreservation. They will freeze part of the ovary, no? So then they will even though you're going to give chemotherapy, which is damaging to the ovary, you can still save the fertility potential of that patient.
So, Doc, for those viewers out there na may concern, ano ba yung mga health problems na mapapaisip sila na dapat i-consider yung fertility or mag-consult sa fertility expert? So aside from, yun nga, cancer, chemotherapy, radiotherapy, what other health problems do we need to watch out for?
Yeah, so to have a healthy pregnancy, we need to have healthy parents. So more common causes that we should watch out for are diabetes, hypertension. These are conditions that you have to watch out for in both the male and the female, because that will affect both of their reproductive potential. Also, common problems like thyroid problems. So any of those systemic problems, kailangan matignan din, and they have to be treated prior to getting pregnant, because sometimes those are the causes also why they're not able to conceive.
Okay, thank you so much, Dr. Gia. We really learned a lot from our talk tonight. And you know what? Our netizens have a lot of questions, and we will answer them once we come back.
Special thanks to Nagit Escorel Dental Clinic, Dermacare, Face, Body, Laser Center, Andy Passion, Eyebrow Embroidery,
Hello mga ka-mugshots! We're back tonight on our favorite topic on female infertility. So tonight our guests are Dr. Cindy Sotalbo, a interventional radiologist, and Dr. Gia Pastorfide, a specialist in female infertility. So now we will answer all our questions from our netizens.
All right. So we have a question here from Karen from Pangasinan. How much po ang egg freezing, Doc Gia? Magkano daw po ang kailangan?
Okay, so actually, this is a very common question in the lay forum that I give. A lot of people ask. Of course, expectedly, it will may kamahalan din siya. So I usually tell patients, if they are under the age of 35, you would expect to spend around 300,000. That's given at the and this cost will actually go higher as the woman ages, because you might need to be giving more of the medication to make her ovulate, no? Yung medication na pampangitlog sa kanya. And that's where actually most of the cost will come in, with the dosing of the medications. So the higher, the older the patient is, the higher dose she may require. In effect, the more expensive the treatment will be.
Oh, actually, follow-up question din po from Anna. Madami sila nagtanong magkano naman po ang dapat ihanda pag IVF?
Still around in that same process. Maybe you could add, because if you would do a fresh transfer, it's already inclusive with the whole cycle, no? Unless it's a frozen cycle, you will have to spend more because of the reagents that you will need to thaw the egg, to thaw the embryo, sorry. So it will obviously become more expensive if they do a frozen cycle. But still, I would quote them in the area of 300 to 500,000.
Okay. So this is from Chris from Isabela. Ang tanong ni Chris ay, gaano po katagal ang lifespan ng frozen na eggs or embryos?
Okay. So theoretically, it's cryopreserved. So indefinite na yan. But of course, as the OB, no, I would tell the patient, it is best to use your eggs within 10 years because you don't want to be pregnant at around 50 plus, diba? So, pinakamaganda, after na-freeze mo yung embryo mo, to use them within 10 years.
Oh.
Although, technically, you can freeze it indefinitely.
Okay, noted. Noted yung 10 years na yan. Okay. We have one last question from Annie. Mayroon po bang patient assistance para sa mga interested na magpa-egg freezing or IVF? I think financial assistance yata yung tinatanong nila dito.
Oh, unfortunately, in the Philippines, hindi siya part of insurance plans eh. I'm not aware. Or it's not even in the Medicare.
Not yet yata.
So it's usually a private, it's shouldered solely by the patient, 100%. So in other countries, yes, they do. So unfortunately, I can't say the same for the Philippines.
Kailan kaya sa atin?
Yan. Thank you so much, Dr. Gia, for your time tonight. We really learned a lot, and I'm sure our netizens learned a lot. And baka marami pa silang questions. Sana ma-invite po namin kayo ulit next time.
Thank you
So,
for
Dr.
having us.
Gia, do you have any last words for our netizens who's watching?
Yeah, so especially, with this pandemic, now's the time to reflect, no? Because there's all this time in our hands. So kung if time is passing by, I don't think now's the time to dilly-dally, no? If you're getting older, maybe you might consider egg freezing talaga as a way to prolong your reproductive potential. And if you are married already, it's best for both the male and the female to be healthy prior to conceiving. So that means seeing all their other problems, kung hypertension, diabetes, or thyroid problems, to stop smoking or minimize their drinking, even coffee, no? Alcohol and coffee. And if ever they're seeing a doctor already, to know when to see the infertility specialist already. So that's usually after 6 months, 3 to 6 months of trying.
And thank you very much, Dr. Gia, for your time tonight. Dr. Cindy, thank you very much also for joining us. And baka may message ka for our netizens watching.
Okay, I will speak as a patient. Actually, although it might be a bit more expensive, I think worthy siya na endeavor for people like me who are really considering having babies in the future. Okay. Gaabang pa ng Mr. Right. And also, the fact that high-tech na yung mga bagay ngayon is very lucky thing for us. Number 3, ito very practical advice. Even if you don't live in Manila, a lot of our fertility experts conduct consultations via telemedicine, so you just have to look for them. So most of Ma'am Gia's team actually conduct consultations online. So at hand na tong technology na to for us. So that's it, and good luck to everybody who wants to take this path. And Emmy, thank you for having us this evening.
Thank you very much, Dr. Gia and Dr. Cindy. Thank you to our netizens who's watching tonight. So I hope na mahanap nyo na inyong mga Mr. Right at yung mga mayroon na pong Mr. Right. I really hope that mabless rin po kayo with a baby. So as the expert, health is a state of body, wellness is a state of being by Jay Stanford. Thank you mga ka-mugshots, and see you every Tuesday at 6 p.m. Ako si Doc Emy Cua, and ito ang Mugshots Now, Magpahaba ng Buhay. Please follow us on Facebook, Twitter, Instagram, and YouTube. Keep safe and God bless everyone.
Special thanks to Nagit Escorel Dental Clinic, Dermacare, Face, Body, Laser Center, Passion, Eyebrow Embroidery,